less effective vitiligo, so are currently used in the treatment of vitiligo, particularly in children. And when the inflammatory reaction is particularly relevant, it could be then with some resistance in therapy with the phototherapy, a combination therapy could be adopted. Either as combination therapy, corticosteroid plus phototherapy, or as sequential therapy. Topical immunomodulator plus phototherapy, just to avoid the risk of the combination of immunosuppression, some of the immunosuppression of phototherapy in topical immunomodulators. But what is being recently reported that during the pathogenesis of the disease, it could be a relevant role or release of interferon gamma pathways through and the activation of JAK1 and 2 molecules to lead to the production of keratinocyte chemokines capable to interact with the melanocytes. So this lead, according to the proposal of generics, this proposal of the to use JAK inhibitors to treat vitiligo. It has been reported, this is the first case reported in patients that was a recent vitiligo treated with corticosteroid, tacrolimus, UV, with no responses, with progression of the disease, oral toxicity has been administered for 5 months. And she was capable to achieve a 5 complete repigmentation. You can see the patients had the limited vitiligo and most recent vitiligo, so it works probably perfectly just in the early phase of the disease. And sometimes you can observe also with the high dosage of corticosteroids. And this is another case, functional limitations with the combination of basal reactive and vitiligo, where these are JAK inhibitors that has been has been administered for 12 weeks. He was capable to achieve a repigmentation together with the hair growth, but the stop of the therapy. The pigmentation is a period gain. Has been reported the first day about Antonella Toschi. The use of JAK inhibitors not necessarily are capable to maintain the clinical success that they achieve during the treatment. But in any case, this indicates that it could be a possibility to treat the disease just acting through some of the kinases or the intracellular messengers. And probably we can try to evaluate, now some companies are more interested in trying to evaluate which could be the best approach using possible anti-inflammatory molecules to treat vitiligo. So are opening a new perspective. What we can achieve in patients non-responding with phototherapy using combination of phototherapy or cumulative phototherapy, probably this repigmentation is related to the appearance or the persistence of some melanocytes in the repigmented area, as it's been described. And possibly this can explain the diffuse repigmentation, that it is another form of repigmentation that we can achieve treating vitiligo patients. But we have to take into consideration that in any case, the melanocytes from the patients from the normal appearing skin present some metabolic alteration, and some alteration of the antioxidant level, and present some basically oxidative stress. So we believe a lot about the combination of antioxidants together with phototherapy that generate the antioxidants capable to contribute to stabilize the disease and contribute to improve the effect of phototherapy, as we have demonstrated some years ago in this double-blind clinical trials performed some antioxidants plus phototherapies. And this is probably related also to the possibility that we have some dermal stem cells. So possibly some repigmentation, diffuse repigmentation may be related by the activation of some dermal stem cells. So we have some follicular stem cells that are present on the dermis. So we can try to reach a lot of them. But what we is probably we have to consider how is the dermis built up. Right now some evidence are appearing that not necessarily the dermis is so normal vitiligo patients. There are some recent papers that some new data from our group showing that also fibroblasts of vitiligo patients present some functional abnormalities. This can have a role in the possibility to gain the repigmentation. And this is one of the people are trying to solve this aspect, to combine phototherapy with laser, CO2 laser, then with laser, that are less capable to work on dermis, just to reactivate the dermis for rejuvenation. So possibly some reactivation of dermis, some induction of the production of growth factor upon the fibroblasts, are capable to contribute to achieve cell repigmentation in association with phototherapy. It is something new, and just in the view to try to treat the entire skin in vitiligo, and not just focus exclusively on the melanocytes. And then we have to take into consideration that we have to consider the global assessment of the disease, and possibly the global assessment of the skin. So the first point, the point was just to maintain the general pigmentation. This is what has been recently proposed. When we treat the patients, we were capable to gain some repigmentation. It's useful to continue to treat the patients during the weekend with tacrolimus, as has been suggested to maintenance of the treatment in children and patients with atopic dermatitis. And this is data from the group of theory passed on, showing that really continuing this weekend therapy with tacrolimus maintain the repigmentation better than with placebo. So we can take into consideration to continue to treat the patient, because probably even when we achieve some repigmentation, we cannot say that we have solved the problem, because we don't know exactly which is the pathogenesis of the disease. So we cannot define that the patient is completely cured of the disease. So this is a schema we can try to approach the disease, to try to halt the progression with corticosteroid, topical immunomodulator, or combination therapy, phototherapy plus corticosteroids or antioxidant for phototherapy plus phototherapy. We try to induce repigmentation with phototherapy plus antioxidants and surgery, or using different types of surgery we will see it shortly. And to try to possibly upper melanocyte, and to try to stabilize using topical immunomodulators and antioxidants that can be used for a long period after the repigmentation. Then the last level of therapeutic approach would be to use grafting, using patch grafting or dermal cell suspension grafting, or cultured cells, cultured melanocyte grafting. The mechanism that this is learning us how the melanocyte is able to move. Why we can use the patch grafting, we can transplant tissue cells, and we can capable then applying phototherapy to have the repigmentation of the area. Certainly the process is related to the activation of the release of some growth factors, the modification of the expression of the carrier that is one of the proteins associated with the cells capable to grow on the cells, so capable to activate the process of any migrate to the melanocyte. And this is teaching us we have to take into consideration of this aspect when we want to treat vitiligo. We have to take into consideration this aspect of the interaction of the crosstalk between keratinocyte, melanocyte, fibroblast, and the extracellular matrix to achieve a true tropical approach of the disease. And so probably the class works because the melanocyte is actually vitalized with manipulative factor, and just because there is an alteration level of the So finally, we have to consider the global assessment of the disease. We have to try to consider interpretations. If we want to interfere with the process of the generation of the melanocyte, we have to consider the problem we have to treat the normal skin, and not necessarily the feeling to try to focus on the pigmented skin that we have to try to reduce repigmentation. And what has been demonstrated, some data from our group, if we look for the normal skin of the patients with vitiligo, there are clear signs associated with the aging. So it seems that in some way, vitiligo is sort of aging disease, the pressure status disease. This is demonstrating that keratinocytes overexpress p53 and some proteins associated with the aging process. And this is what has been recently published by the group of Valenta that the number of melanocytes in the basal layer and the normal skin in these patients are reduced with respect to the normal people, because there are a number of detached melanocytes, just the normal skin. So we have to take into consideration that we have to try to stabilize the pigmentation of normal skin to the patients with vitiligo. So what we can say here, that vitiligo is a quite interesting model to examine the degenerative disease, because probably we can follow what happens, which induce the degeneration of the melanocyte and possibly could involve the metabolism of other cells, keratinocytes and fibroblasts, which could be the start for the immune activation and the generation of immune phenomena. It's quite interesting to try to follow how an autoimmune disease can appear. And this It will be capable to achieve a repigmentation. How will be capable to activate precursor of the nanocyte, stem cells, or not differentiated cells. So basically, it will be a model for a regenerative means. And just to say that probably we have to take into consideration to have some tailored alternatives according to the single patient, according to the phase of the patient, to try to stabilize inflammation in two components, and then after several cycles of therapy, if there is stabilization, to try to intervene for the repigmentation, medically for the medical surgery. And just now we will discuss usually about these group of patients. Now, try to enroll for this international study of the course, not you are currently by journal. Thank you very much.